Imagine someone who teaches you, lifts you up, encourages you. Someone who helps you grow, helps you eat right, keeps you moving, and makes you feel connected. A presence that supports you, empowers you, and gives you strength at every step of the way. Imagine this person being always by your side, like a friend or a family member. Your companion in MS coming soon.
Hi, welcome. My name is Lisa Kiblinger, and I'm the Medical Director for Aptar Digital Health. And we are here today with 4 wonderful people who have agreed to be on our presentation, our webinar. The webinar is called Empowering People with MS, A New Era in MS Care. And I want to thank you all for coming. Dr. Williams is a board-certified neurologist specializing in MS based in the Atlanta area and founder of Joy Life Wellness Group. Thank you for coming today.
Absolutely.
Denise was diagnosed 1 year ago, and she is here to help share her story. We also have today Bria, who was diagnosed in 2021 and has a very interesting story as well. And we have Vanessa, who was diagnosed 22 years ago and has also come to share her story. So welcome, all of you.
Thank you.
Thank you for coming. So one of the things that we want to talk about as we move forward is that the audience will have the opportunity to answer some questions that we'll put in on their screen. The questions will pop up and they'll be able to answer some questions as we move along. We have an app. The purpose of this is we have an app that we're really working towards presenting to the United States. There's several countries that actually have the app already, and this app will be something that has already been very well researched with patients and healthcare providers, and we are continuing to get more and more feedback from you all today and from our audience. So we look forward to presenting this probably later on in the year. So the first thing that we want to talk to you about today, and we want you to share with us, is your story about MS and about your diagnosis specifically. And so Vanessa, I'd really like to start with you. I know it was a while back, but I think that you have a very unique story, and I would like you to share that with us.
Well, I was diagnosed 22 years ago, and I thought I had a pinched nerve. I had been working, and I had been doing some moving, and started feeling numbness and tingling in my right leg, right buttock, and right foot, and tingling. And so I went to the doctor, and they told me that I had a pinched nerve. So I began to see a workman's comp doctor for that. It never did go away. And then it kept going and going on and going on for about 2.5 months. And finally I started having severe muscle spasms, 15 to 20 per day. And I felt like I was being electrocuted. So I was at my wit's end. I ended up going to the ER just to get some type of relief. I was desperate. And I was fortunate enough to have a great neurologist that was called in, and he diagnosed me that day.
Oh, wow. Wow. How did that feel when you got the when you got that diagnosis?
It was a tremendous relief. I felt like I had been given a blessing. I had been suffering for so long. I just wanted somebody to figure out what was wrong with me. It was hard to hear the diagnosis, but at least I had an answer to what was going on with me. So I was relieved.
Thank you. Thank you very much. Bria, you have a different story. So would you please share your story about your diagnosis?
Yeah, so with my diagnosis being 2021, it was in the middle of a global pandemic and just kind of staying away from things. But I've always known to be clumsy. I stay active, but kept tripping all the time. It was just, Bria's just going to fall and trip. It's okay. And I was starting to get more tripping and things like that. And I was like, Ma, I don't think I feel well. I want to go to the doctor. And I don't always say I want to go to the doctor, but this time I was like, something's not right. Went to get out of bed, completely fell to the floor. Couldn't feel my arms, couldn't feel my legs. Now I'm terrified. Went to the ER, went through all the testing. They actually said I was healthy, I just couldn't walk. But I had a doctor say something's up. After that, after going through more tests, after an MRI, I was diagnosed with multiple sclerosis with 5 active lesions at the time. But come to find out, there were several lesions that were not active, which meant I've actually had this for a long time, but had a very interesting experience that actually brought on the diagnosis.
Thank you for telling us. And you, Denise?
So I had similar parts of the story in that I had the spasticity and issues with that. And initially we thought mine was sciatic nerve as well. But I had been raised as an athlete and still a coach and have the rub some dirt on it mentality that I got from my dad when I was a kid playing ball. And so I just kept rubbing dirt on it figuratively and pushing through and, take the hard knocks. And I've learned that there is no hero in pushing through. And when the sciatic nerve kept going, we did all the things to lose weight, to feel better, lost the weight, still didn't feel better. And then the trip to the neurologist came. And within 5 minutes, the PA said, I think you have MS. And so for me, it was very quick, but very long and drawn out process because of how I chose to push through.
Very good. You all have very compelling stories, and thank you for sharing them. I appreciate that. And Dr. Williams, we have talked about different ways of finding out you have MS. From a doctor's point of view, how do you see your patients present?
Yeah, so it's an excellent question and one that I get all of the time. One of the difficulties is that symptoms of MS are also very common to other diseases. Many people who are initially diagnosed with MS, as you heard from these wonderful ladies, are very healthy. And so if a healthy young person comes in with a symptom, oftentimes a healthcare professional will think of the least severe thing that could be happening, and they may not think of MS. So people may be diagnosed with a pinched nerve or sciatica or other symptoms, and it may take either worsening of those symptoms or presentation of a dramatic symptom like what Bria described, where she couldn't walk, that would lead to a diagnosis.
Thank you. Very helpful. Very helpful. And so the next thing that I want to talk to you all about, and like I said, there's some polling questions that are going to come up. And when we, for the audience, so when we talk about what people with MS go through in your journey, what are some unmet needs that you felt like early in your journey that was something that could have been done a little better, or you could have known a little bit more? And I guess we can go in the, I'll start with Bria.
I think for me is I didn't know what MS meant. It was someone told me, hey, you are diagnosed with multiple sclerosis. I immediately leaned forward and said, what is that?
Okay.
And that was an aha moment for me because I'm a researcher. I need to know what's going on. I like to know I'm okay. But you're now telling me I'm not okay because of this new term. And now not knowing that, I would love for it to be a little bit more common. More common that if you say multiple sclerosis, it's a household disease that then I know what to do next. Because at that point, I didn't know what to do next. I knew internally my goal was I want to walk again, but I need to now know how am I going to live my life with this thing called multiple sclerosis. It'd be good to know that information a lot earlier.
Thank you. And Denise, do you have something, an unmet need that you feel like people with MS, especially early in their...
I think knowledge is power. I'm a teacher, educator at heart, and knowledge is power. And I had no knowledge of what MS meant, what the different types of MS are, how it's going to affect me, how it's going to impact my family, my job, my life as a whole. How will it impact me? And where everyone's disease is going to present differently, that poses part of the problem. But the lack of exposure in society is a big part of that.
Yeah, and I happen to know that you both are like working for the MS Society and have been working to get the word out a little bit more. That's really great. And Vanessa, I know you've done some work in the past too.
Yes.
And do you have some things about unmet needs that you'd like to share?
I would say I would piggyback on the same things that they said. When I was diagnosed, I felt kind of alone, like nobody knows what this is. I found myself explaining a lot to people what the disease is. I didn't know, they didn't know. I also felt kind of isolated until I got into some support groups with other people that had the disease and that I could become friends with, and we could kind of talk about our journey with the MS. Because some of my family, they were so shocked as I was about me coming down with the diagnosis. They were in denial about it and did not want to accept it. I didn't want to accept it either. But when I joined some of the support groups, that really helped me because a lot of people do not know about it. So just to have somebody to talk with about this new diagnosis helped me a lot.
Very good. Very good. Thank you so much for your answers for this. Dr. Williams, do you have anything that you see with your patients that are unmet needs?
Absolutely. So, not to repeat what the other ladies have said, but definitely a need for good information. So we all know if you go to whatever your favorite search engine is on the internet, you can find a lot of information, but it's not always solid information that comes from reputable sources. So having, reputable sources of information is extremely important for people to know where to go to kind of understand their diagnosis and process it. Also, that sense of community is extremely important, as has been pointed out, being able to see others that look like you. And then, of course, looking at MS is a lot of the work that I do is focused on underrepresented groups, right? People who traditionally were not thought to get MS. So I think there's a big need for more research to better understand MS in people of different age ranges, pediatric populations over 55, those who are ethnic minority groups, people who are in sexual and gender minority groups. So there's a lot of work that needs to be done.
I'd like you to expand on that just a little bit more and talk about some of the research that you've done.
Yeah, so when we think about research, when I first started practicing, we always thought of MS as a disease that primarily occurred in Eastern Europe or people of Eastern European or European descent. What we found here in the US, of course, I live in Georgia, and I would go to my lobby and most of my patients didn't look like they were from Eastern Europe. And so we began to look for information to better understand, different populations, even to understand what to do with women when they were pregnant. When I first started practicing, we told people not to have babies, or people were told not to have babies, or, we had all of these things that we didn't understand. And so I began to do research just focused on better understanding MS in minority populations. And we have had some great work that's come out of it. And we also raise a lot of awareness about the importance of research participation from all groups of people with MS.
Excellent. Excellent. So we have talked about our app a little bit at the beginning. And so that leads me into the hopes that we have for what we can do with an app. Our company has another app that's on the market, and it's in use called Migraine Buddy. And Migraine Buddy actually has an arm that recruits people for research studies. And the thing that we like about Migraine Buddy is that it doesn't have, it's colorblind, I guess you could say. It only requires that someone have a phone, which that can be a barrier too. But we know that we are reaching a large population with that app, and that's what we'd like to do with this app. When again, like I said, we're in the investigation stage, so we're really trying to find out as much as we can, and you all have helped already so much by all of your contributions so far in our previous talks and in today's webinar. I do want to say that our Aptar Digital Health would like to empower people with MS with this app. And so we have included in our original app it's available in other countries, hundreds of patients and healthcare providers and specialists to help us work on this. So we want to continue to make it better. We want to build our focus on educating. So it sounds like we're right in line with what you're talking about, and with helping people better understand their disease process and the management of their disease. And we want to make sure that people have the ability, if it turns out to be something that everybody here in the U.S. focuses on, that we want to be able to give people the opportunity to maybe record their experience, their symptoms, their medications, things that in a meeting that they might be able to share with their healthcare provider. So do you see that those things, maybe, Vanessa, are helpful for someone with an app?
Oh, definitely. Everybody is extremely busy nowadays. So anything that can make you more organized to help you manage your disease process, putting it all in the app, being able to pull it out when you go to your doctor's appointments and share with him some symptoms that I've had, what days they occurred, how long it lasted, all of those things is only going to help your provider to help you to be able to stay healthy for as long as possible.
Thanks.
That would be awesome.
Yeah. Denise, is there anything you can think of that an app can help you with?
For me, I tend to lean towards the positive side of all things. And when I go to the doctor, my pull string answer is, oh, I've had more good days than bad. And I tend to neglect the side of my health that isn't great and will frequently forget, because I don't want to remember necessarily the tough days, the hard days, the nights where I wake up with spasms. So having an app where I can record it and it's there for my provider will make it so that it doesn't go missed.
So are you saying it keeps you accountable?
It holds me accountable when I don't necessarily want to be sometimes, for sure.
Okay, very good. Very good. And I know, Bria, you had a few things too that you thought might be good.
Yeah, I have my phone near me most of the time. And so keeping track of different symptoms, how I'm feeling would be beneficial, because I also have a role in taking care of myself. And in my role of taking care of myself, I need to be more responsible. And how can I do that? By keeping track, managing what's going on. So then when I'm having those conversations with my doctor, it's not, oh, I'm okay.
Yeah.
Good to see you. It's okay. I have had this problem, this change, this positive thing happen, because the positivity is also important to keep track of. But now we can have a real conversation about my health, not the expectation of how I'm supposed to be presenting myself as being a healthy person.
Excellent answers, all of you. Dr. Williams, what do you think that an app can help people with MS with?
Yeah, so I echo what everyone has said, some amazing points that have been made. I think the most important thing is that we now engage in shared decision making. And so shared decision making is a two-way conversation between an individual who has a condition and their healthcare team. And so we want that conversation to have input from those who are living with the condition. We don't just go and tell people what to do. We come up with a plan together. And so if there's a way for people to keep track of those symptoms or things that they're concerned about, or make sure that they get their questions answered when they go to the doctor, we want them to be as empowered as possible so that we can come up with the best plan together.
Excellent. Thank you. That's great. Okay. This is so wonderful. Okay, so education and empowerment experiences and initiatives are really a focus of ours. And so what we would like to ask now, Dr. Williams, we will start with you this time. Can you share your efforts in educating people about MS, things that you've done to help empower your patients?
Absolutely. So I do a lot of work focused on education. I love to teach, and we have a nonprofit called the Joy Life Foundation. And through the Joy Life Foundation, we have a couple of initiatives that focus on patient empowerment. One of them being Brain Chat with the Nerdy Neurologist. I'm the Nerdy Neurologist. And we do a bi-weekly podcast where we talk about topics ranging from how to prepare for your doctor's visit to symptom management. We have spicy ones where we talk about intimacy in MS. So all the topics that people want to hear about, and we educate that way. And I have different experts in the field as well as patient advocates come on and share their experience. And then we also do roundtable discussions in different cities across the U.S. that focused on empowering patients and preparing them, and also the importance of involvement in research, amongst many other things, such as this video that I do to try to help educate the community.
Excellent. Thank you. Thank you for what you do. And so, Denise, tell me what you've done to educate yourself over the years and what you found useful.
So I immediately hit the ground running when I was diagnosed. It was the fast and furious, find out as much as I can, go to the reputable sources and find good quality information and get involved. You know, I immediately met with the National MS Society, started getting involved there, meeting with legislators, representatives, trying to enact change. I've been involved in a few podcasts, and as of recently started writing a book for children, because that's where my heart is. My heart is in my classroom with my students. And how can I make that awareness known earlier so that more people know and they can understand?
Wow. Thank you. Thanks. Okay.
Same thing. I also got really, really involved. I was quiet the first 6 months because I felt like I needed to process it myself. And then I was like, okay, I'm ready to tell everyone because we have to have a conversation. So I got involved with the National MS Society, also got involved with having tough conversations with family members and having those conversations like, we're going to talk about this thing beyond it being just a disease. This is now something that's impacting our family. So I now talk about it with my family members. I've talked about it with church members, with neighborhood community members, because this is a bigger conversation. So if that means I'm talking to legislators at our community town hall, I'm talking about how is healthcare impacting me in my area. Now, how is healthcare impacting you in your area? And including others in the conversation, because it's not just we're going to talk about this topic and say, oh, I'm unaware. It's let's talk about this topic. Now, how are we going to inform each other and continue to hold each other accountable?
Excellent. Excellent. Thank you. Yeah.
Well, for me, I just basically accepted my diagnosis. I became a member of the MS Society when I was first diagnosed. I didn't do anything huge. I just informed my family, explained to them what was going on with me, and I keep myself educated about it. I don't share it with a whole lot of people. Just my really, really close friends. They're very concerned about me, so I share anything that's going on with me with them, or any changes, keep them updated, and just keep myself educated through my magazines that I receive from the MS Society, and just any literature that I come across and read. So just that, it's just pretty basic for me.
Okay, so thank you. Appreciate you sharing that with us. And, you know, I think all of you are doing a lot in your communities and your families to help them know more about your process. And of course, everybody that you teach about your MS learns about it for everybody else too. So that's a really great thing to do. Really great thing to do. Dr. Williams, do you have any suggestions for people who are talking to their families about MS?
Absolutely. I think, the first piece is to educate yourself, right? Because you can't explain something that you don't understand. But I often encourage people to bring their family members to their doctor visits. Mm-hmm. It's a great way to talk about information, for people to be able to ask questions in a very non-judgmental environment. Mm-hmm. And of course, we all know that when we say it, the family member doesn't believe us, but they do believe it when someone else says it. And so sometimes it's just having that echo of, no, fatigue is a real symptom. Yes, cognitive problems can happen. They're not ignoring you. This is part of the disease, unless they are ignoring you, right? And so I think that having that reinforcement is important. Also, if there are educational events, bringing your family members to those are also equally important, because again, they see other people who are saying the same things and recognize that you are not alone, that it's not an isolated disease, and that many of these things are common to other people who are living with MS and common to other care partners and loved ones of those individuals with MS.
Excellent. Thank you. Thank you all. Thank you all for that. Okay, so how do you think that maybe an app could help improve communication? And I think I'll go to Bria for this one. Yeah.
It just gives us words for something, because it's important to know that other people are in it with you. And so when you have an app to say, hey, let's take a quiz and figure out how I'm feeling. Oh, wait, 90% of other people rated the same thing? Okay. So I'm not by myself. And having an app or a community, that support system to say, let's keep track of what's going on. Let me stay educated. Let me ask myself questions and have moments to reflect, but also keeping it in one place is beneficial. Because I take notes everywhere, but having it all in one place will be helpful to say, I know where to go. I know where to go to get this information. I know how to keep track of my symptoms, because it's important to say that's also a part of my healthcare team.
Very good. Thank you.
And can I add
Yes,
something?
absolutely.
When you think about different symptoms and things that you track, it's important to process that information before you go to your doctor's visit. Just like it can be frustrating for someone to describe their symptoms, it can also be frustrating for the doctor when someone maybe hasn't thought about it, right? And you say, I have a pain. And I'm like, well, where is it? I don't know. Okay, well, is it sharp or is it dull? And you're like, oh. So if you have that time or a place where you can process that, then it helps your healthcare team to help you even more, because we have the words and kind of the thought through the process to help us identify and how to best treat or deal with that symptom.
So that might be something that an app could do, is ask you, have you thought about your symptoms before you go into the visit?
Yeah. Or pain, what type is it? Where is it located? How often is it happening? Does it go? Does it come? All of those things make a difference.
That's something we could definitely do. That's something we could definitely do with an app. Yeah. Thank you. Yeah. And so, Denise, I wanted to ask you about you said earlier that you have talked with your legislators.
Yes.
What are the topics, main topics that you go to talk to them about?
We've been talking mainly this year about the pharmaceutical benefits managers and trying to reduce the cost of prescriptions for patients. I know personally my prescription is $10,000 a month. And if you can imagine that on a private school teacher salary, it's not feasible. And then the conversation became, because my medication was unapproved, that I needed to change medications to a different one that everyone qualifies for their program. I don't qualify for their program. And so then the conversation became between my husband and I, do we get a divorce in order to continue my medication?
Wow, that's a hard question.
So when I went to meet with my legislators, I explained my option is to get a divorce to stay in the state of health I am. And I won't say to stay healthy, but to stay in the state of health I'm in currently, to get a divorce, which is ridiculous. We've been very happily married for a very long time. And thankfully my medication was approved, I'm still on a program, but those conversations shouldn't have to happen for anyone. Healthcare and your marital status should not be a conversation you're having with your doctor, but that is in my medical chart. That is, goal number 2 is to keep me married. Goal 1, keep me in remission.
Okay, thank you. Wow, those are tough conversations, very tough conversations. And so, Vanessa, I know that you said earlier that you had some advice for people with MS, because you've had MS for a long time and you've kept working and you've been very active. And so I'd love for you to share your advice that you have.
I would say just keep moving. Stay optimistic. When I was first diagnosed, I was devastated. I thought, this is a death sentence. How could this be happening to me? But even though my family was devastated, I was devastated, I got past that, and I have not slowed down. I literally walked 4 miles yesterday. I walk about 12 to 15 miles per week. I'm very active. I do have the fatigue, but it's not bad. I just I just stay optimistic. Everybody's course is different. Of course it is. But you have to just keep your head up. And I would also say you have to follow the doctor's orders. That's something else that I have always done. I've been on medication from the very beginning. Some people are not on it, and that's their choice. I can respect that. But I honestly believe that has made a huge difference for me as well. I am not a physician. I rely on the physicians. And that's been my motto. And staying active. And it also helps with just keeping yourself from falling into any type of depression about the disease. No matter if your course, you have some relapses and your course takes a left turn, you can still get back on course and have a good outcome.
Thank you.
You're welcome.
Thanks. Freya, I know you have some words of wisdom you want to share too.
Take the
Some
time.
advice?
Yeah, take the time for yourself. There's moments in this journey that I always thought I needed to keep going and keep pushing, and I wanted to like go past it. Like I can push through the pain, but I've had more moments now of how does Bria want to live? What does Bria want to do? How does Bria want to reach her goals? How does Bria want to rest? Because rest has become a lot more important in my life. And knowing that I don't have to fit to what society has, I am fitting to what I want to live my life and live it the best way I know how, which means taking time to think, to reflect, and say, now I'm ready to move forward. If today's a fatigue day, okay, this is a day of fatigue. Let me rest. Hey, today's another day. I have a lot of energy. I'm going, going, going. Let me go and work out, but I get to choose my yes for the day, which has become very important for me.
Excellent. Thank you. Denise?
So I'll go back to the rub some dirt on it mentality. I have learned to stop rubbing dirt on it, to listen to my body and to pay attention to what it needs. In my classroom, I'll use the term being a bump on a pickle, and don't be a bump on the pickle. Everybody's got something to do, and so I've had to learn how to be a bump on a pickle and be okay with it. And I think that's for me the hardest part, is being okay with doing nothing. So I've had to learn how to be okay with being a bump on a pickle and just sitting and learning how to rest and being okay with resting. I think that's been the hardest part for me, but learning how to do that is so important.
It's great advice, all of you. Thank you. And Dr. Williams, to give advice to someone with MS, maybe someone that's new at MS?
Yeah, so these ladies have covered so much. I don't have a whole lot to add, but I would say it's important to know that you are your own best advocate. Learning about the condition, learning your own body is extremely important to living successfully, and also realizing that you are the central piece of your healthcare team. So many times when we think of a healthcare team, we think of the doctors, the nurses, the specialists, but you are a member of your team. And so you bring a lot to the table. You have a say in the decisions. Do your research and come to the table ready to work, because we want to work together to make or ensure that every person can live their best life with MS.
We would like to know from a healthcare provider point of view, what would you like to see in an app and what would you not like to see in an app?
So I would love to see some type of piece or document where people could write specific things that they want to address at their doctor's appointment and potentially be able to print that out to prepare for their visit. Or if it's a one pager that they could send via email prior to a visit. What I would not like to see is a list where someone is sending symptoms for every day between the 6 months that we saw them last, because sometimes too much data can be extremely overwhelming. So we love to see something succinct, but not like a laundry list of things over 6 months
Excellent. Thank
or a
you.
year.
Yes. Thank you. Thank you. Okay. And Denise?
I tend to lean towards the positive side. So, like, if I'm logging in the morning, I'm going to want to see something that is going to be empowering for the day, so that I can open my day with a fresh set of eyes every morning, and not something where it's going to be a place to dwell. And, I'm living with this disease. I'm not I'm not surviving with it. I am living with it.
You're not. You aren't the disease. You're just
Right.
living with it. Yeah.
So I want that to be presented to me in that way, so that it is a part of my day, but it is not my day.
Yes. Okay. Thank you. And Bria?
Double tap to that because I'm a person. And so I would love to open an app to say, I see Bria in this app, not I see multiple sclerosis in this app. So opening it to reset my day, if it's like a positive quote, if it's something that gives me another aha to my day, it can start me off like, this is a fresh day. Let me get ready for that. Or even ways that I can share quick, not long articles, but quick things with like loved ones, knowing that, hey, here's how you can support me while I'm preparing for my next treatment. So that they're a part of the conversation, not just waiting to be asked how I can help, which sometimes I don't know how they can help, but I'm just saying, hey, I might need help,
Yeah. Excellent. Thank you. Thank you.
I agree about something encouraging when you open it up in the morning to get your day started with a good start. If you recorded something the day before about a new symptom or an ongoing symptom, maybe a little trigger in there that might say something like, are you feeling that? Are you still feeling it today? And just you can go into the app and write something really quickly because it is morning time. You're getting ready to rush off to work. Don't have a lot of time. So just to a place to see, has something changed with the symptom you might have recorded the day before or a few days. So I think just something like that and encouraging.
Yeah. Thanks, Vanessa. That's good.
And one more thing came to me as these ladies were talking, something to share your wins, right? So many times when we think of recording bad things. But I have some people that come back to the office and say, oh my God, Dr. Williams, I was able to walk my dog and I couldn't do that last time. So a place to share your wins or your gains or good things that happened or things that maybe improved would also be extremely
So
helpful.
setting goals, maybe?
Yeah.
Okay. Very good. Thank you all so much. I really appreciate you all coming today and being here and being such a great participant. The first question from the audience is for Denise and Bria. Being recently diagnosed, what do you think has helped you the most?
For me, it's the catch-22 of the athlete mindset. It kind of put me further along in the disease because I was stubborn. However, I have the mindset of it's not how many times you get knocked down, it's how many times you get back up, and that there is no quit. And so for me, it is get up and go as hard as I can every day. And some days it's not very hard, but the get up and go, just relying on the mental toughness that is innate in who I am as an athlete and as a coach, as a mom, all the things. And that's where I live for getting through the diagnosis.
Thank you.
And for me, I set small goals at the beginning. If it was because I was still relearning how to walk and everything. So I didn't want to take on the big thing of this condition. I wanted to take on my small things that I can do. So some of the things I set goals like I'm going to do 4 squats today. Okay, did those 4 squats. I am going to get on my bike and bike half a mile. And I noticed I started celebrating myself, that then I became a little bit more eager to do more things because I was like, okay, I can do this. And it wasn't a checklist of things. It was just more so I want to take care of myself, which means I had to relearn how to recognize how my body was feeling. And then sharing those like goals with a loved one. So for me, my caregiver was my mom. Yeah. So my mom jumped right into mom action, and she was like, okay, it's time for our 4 squats today. Okay, it's time to go get on the bike today. And sharing that with them, it became our wins, not just my win. Yeah. And then as we progressed, we then went to different goal settings, but it became understanding I don't have to have the answer immediately. I can go along this journey, figuring it out with a loved one, how to get the answers I need.
Excellent. And so nice to hear you talk about support. I think you've all kind of talked about that a little bit, your family support and your work and things like that in your community. As we move closer or further and further into using AI for things like our app and things like healthcare, what do you see as being benefits and drawbacks?
So definitely the benefits of AI are that you can synthesize a great deal of information and summarize it and make it succinct. But I also think it's extremely important to have humans who do the work fact check some of that information. Certainly, every person with MS is different, and we have to be very careful about the information that we send to people because we may give them a unrealistic impression, based on one person's results, et cetera, et cetera. So it's important to have people who are doing the work to look at the information, but we also know that AI can synthesize and do a lot of research in seconds or minutes that it may take someone hours to do. So we want to employ it, but we want to employ it safely.
All right. Well, thank you all so much again. This has been an absolutely wonderful and very successful webinar. We're thankful for each and every single one of you for coming today and for your contributions. We want to thank our audience as well for coming and for participating and answering the questions and providing questions to us for our question and answer session. The rest of the questions will be answered after the webinar is complete. And we want to thank you all for supporting Aptar Digital Health and our upcoming MS app. We hope that you have learned something new around the future of care for MS and how people with MS work with their MS and manage their MS through today's program. And we also are looking forward to reading your opinions and feedback and to develop an app that everyone is able to use. Thank you so much for coming today.